A 2023 study conducted by Frontiers in Global Women's Health found that without routine standardized screening, 75% of women meet the Diagnostic and Statistical Manual of Mental Disorders criteria for depressive and anxiety disorders and are not identified at that time. And only 10% of women requiring mental health receive care. Only 10%.
God.
And to make matters worse, even if these women are diagnosed, only 15% of them receive evidence-based treatment. Welcome to The Scaries, brought to you by Racer Co. I'm Sky.
And I'm Talitha. We are proudly broadcasting from Treaty 4 territory and the homeland of the Métis. In each episode, we tackle the alarming, inconceivable, questionable, shocking, and scary statistics relating to, impacting, and intervening with the lives of women and girls worldwide.
You'll hear the scary truth, take away tools and tips, and learn about what you can do about it. And really, the Scaries is an opportunity to raise awareness, share resources, and use our voices as women and supporters of women to make real change. As always, the opinions expressed on this podcast are solely our own or solely our guests, and it's for entertainment purposes only, and we could be sharing some information that could be triggering to you, so please listen with caution.
As straight, cisgender, white, able-bodied settler women, we are very aware of the privilege that we have, and we want to use this platform to spread awareness about the scary reality that women from around the world face in different life situations.
And why?
Because sometimes nothing is scarier than being a woman. Hello, Scaries fam. Well, it's officially now May. In fact, almost halfway through May. And do you know what that means, Sky?
May. There's so many things in May. What's happening in May that I don't already know about?
So many things. The flowers are springing out.
It's gonna be May.
If Justin hasn't told you once, he's told you 1,000 times. Okay, well, that, Justin, obviously. And Mother's Day, of course.
Yes.
And in addition to things like missing and murdered Indigenous women and girls and Two-Spirit people, also known as Red Dress Day on May 5th, there is something else that's happening. It's actually declared in 2021, the first Wednesday of every month was declared as World Maternal Mental Health Day.
Wow.
Yeah.
Who knew? Well, I gotta
finally
say,
getting some days. I know we always complain.
honestly, and 2021, it took us till 2021 to get this day.
Yeah.
And I know, actually, I think May is also just generally Mental Health Awareness Month.
Yeah.
So I'm glad we get one day of that as moms around our specific mental health. But honestly, I'm just glad, whatever. We got it as a mom, as a sister, as a daughter, as an aunt, as, someone who's been in the village of many moms. This is heavily, heavily needed.
And people are talking about it, which is great. That's all you can ask for.
Totally.
Yeah. Well, yeah, I absolutely agree. And so surprise, surprise, today's episode will absolutely be focusing and unpacking the real life scaries and statistics surrounding mental health challenges that new mothers or new childbearing folks have dealt with for eons, and I say eons, and are still dealing with on top of the primary life source for a new human. Like someone absolutely relies on you for life.
That's not hard enough.
Yeah, you got to deal with also other things that creep in. And we're really, really excited because we are not experts on this. So we have brought in a special guest and a specialist in perinatal mental health, perinatal meaning pre and postnatal, the whole natal experience, who will shine a light on just how severe this issue is and what we can actually do about it. So let's dive in, shall we?
Oh, yes. Well, like you mentioned, perinatal being growing the baby stage, and I think up to a year after that. And I think that fourth trimester, that period right after they have the baby, is really that unspoken period that we kind of chatted about in our last mom's episode. That is a major doozy, and I'm telling you, it's major for many reasons. You're healing physically. You are going through huge hormone drops and changes mentally and across your body. It is a big one. In relevance to this and this episode, it's particularly important that we bring awareness to it because there is an increased risk for onset and relapse of mental health conditions for women in that fourth trimester and really in the whole year after baby's born. So this is sadly heavily overlooked, and typically the focus of care in general and health in the first year of postpartum is on the infant. There is not a lot of talk about the mom. You know, you might get that 6-week checkup, you know, to make sure everything's healed up and, you know, the pap or whatever else you have to get, but that's about it.
Well, that's even just like physically you, not like
and not even
brain
mentally
you.
Yeah. So you have, I don't know how many appointments for your child, like 2 months, 4 months, 6 months, 8 months, and all the vaccines. But they may talk to you once about how you're feeling with a questionnaire, if that even happens. So this is something this is a big problem.
Yeah, huge.
So a 2023 study conducted by Frontiers in Global Women's Health found that without routine standardized screening, 75% of women meet the Diagnostic and Statistical Manual of Mental Disorders criteria for depressive and anxiety disorders and are not identified at that time, and only 10% of women requiring mental health receive care. Only 10%. God. And to make matters worse, even if these women are diagnosed, only 15% of them receive evidence-based treatment.
Okay, how is nobody helping these women?
I don't know what's going on here. It's mind-blowing to me that it has taken us this long and we're still not even close to having like a standardized system going on with helping women. Nuts. Like just not
absolutely
good.
nuts.
So, I mean, and to top it all off, there's also these barriers. There's so many barriers that exist. So not only are they not screening, they're not doing the test in the first place, but then once you do know that you have a problem, there are many barriers that exist that stop you from accessing you or prevent you from accessing that support.
100%.
Which we're going to get into in a little bit. But of course, let's define some things first, because this is a mouthful, this perinatal, and honestly, very unknown, and we're not educated enough about it. So we've got to do some education first.
Yeah. So let's learn along.
Yes.
Shall we? Okay. So first things first, what types of mental health disorders are moms dealing with and how are they classified? According to the Canadian Perinatal Mental Health Collaborative, perinatal mental health disorders are characterized by distressing feelings that range in intensity from mild to severe during pregnancy, prenatal, and throughout the first year after birth, postpartum. The risk factors of developing perinatal mental health disorders include a history of depression and anxiety, low marital satisfaction, intimate partner violence, lack of social support, and isolation, all things that can be very commonplace issues that a wide proportion of women face. Obviously, that is not an exhaustive list, but a lot of women can go through that. Another similar and seemingly interchangeable term for this is perinatal mood and anxiety disorders, PMADs, which include a spectrum of mental health disorders that can affect an individual from conception up to 12 months after birth. These disorders can range in severity and include depression, bipolar disorder, psychosis, generalized anxiety, panic disorder, post-traumatic stress disorder, and obsessive compulsive disorder. For the purposes and consistency moving forward, we will refer to them as PMADs. So increased PMADs severity are often associated with impaired functioning, especially in relation to a woman's ability to care for her infant and the formation of a secure infant attachment, which may in turn be associated with poor social, cognitive, and behavioral outcomes in the child. Women experiencing PMADs, severe PMADs, have a hard time taking care of themselves, let alone a baby. So it is critical that we are more aware of these symptoms so families experiencing this in the perinatal period receive timely support and care.
I just shake my head. Like, I just can't believe this is not more talked about, especially us as like generally new moms. And how much, how many things do I follow on social media and mom channels and this and that? No one's talking about it.
No. And like
nowhere.
The numbers show.
Yeah. What the heck?
That definitely more people are dealing with it, just not talking about it.
Or maybe they don't even know they have it.
True.
It's just,
also that. Yeah.
I think mental health in general is a topic, like a more topic of conversation these days, as mental health, especially post COVID, like everyone's kind of, more aware of it and more aware of the impacts of it and mental health disorders. But digging in specifically to maternal mental health, I think this is a very untapped sector that we need to dig in more.
Yeah.
So
Yeah, we definitely need to dig in more. Yeah,
and that's why we're doing this.
That's why we're here.
Yeah.
It's absolutely mind blowing that there's such a lack of awareness, especially with how prevalent it is. Again, we saw the numbers. Recent data shows approximately 1 in 5 women experience PMADs in Canada. But when you drill down into specific postpartum disorders and throw a pandemic into the mix, the numbers dramatically increase to 1 in 3 for postpartum depression and 1 in 2 for postpartum anxiety during the COVID-19 pandemic in Canada. 1 in 2.
So
one of us.
So yeah, for sure. One of us. I mean,
maybe both of us.
Probably both of us.
We're being honest. Yeah, absolutely wild. And there's more. Now, I don't want to scare you even more, but this next stat is actually pretty horrifying. Did you know that completing suicide is the 4th leading cause of maternal death during the perinatal period and accounts for 5 to 20% of maternal deaths in Canada?
I know. I literally have goosebumps.
Yeah.
Like I did not know that. And
suicide. It's absolutely heartbreaking.
It is completely heart-wrenching and just so close to home. Like we said, we're moms.
Totally.
And I took the screening in my recent pregnancy, and I did the first one too, I believe, with my OB, and then again after, and I think the first 2-month appointment with my baby.
Right.
And I think I was like 1 point away from being someone who was like, oh, you should talk to somebody. And they're like, do you want it? I'm like, no, I think I'm good. Like I have enough to worry about with this new baby. I don't have time to worry about myself. And honestly, that's just how I roll.
It is, like, honestly.
A lot of mom too. It's like, no, I don't have time to like schedule appointments. I can't even imagine an appointment right now. It's hard enough to get up to this appointment. Like just, you know, so yeah,
but imagine how detrimental that actually is.
I know. And it's like, well, maybe that's a sign right there that I should have, that the person was like, actually, maybe you should.
Yeah.
Let me sign you
actually,
up.
This is a 1 point extra.
Right. Yeah. 1 point.
That.
So you're tipping the scales. Let's go.
Yeah.
But no. And like never been treated. And like the stats say both of us had our first babies during COVID, probably had some
100%.
postpartum anxiety, depression in there too.
Yeah.
Nothing.
But like no time to deal with it. I mean, I knew that I had anxiety before I had my son. I mean, like before I got pregnant, I had anxiety.
Did you stay on your meds? Were you allowed to stay on your meds? Okay, well, that's good.
They were like, for the love of God, stay on your meds. And I was like, got it. But they actually increased. I had to increase my dose because I got like so anxious. But it was like pandemic and then just like being pregnant and then all these other things. It was crazy.
Honestly, I think that in general, we are super lucky because we got through these times without even knowing it, because we had such a strong support group around us. We had the privileges of having a spouse and a partner to help us through this. We had financial supports, we had network supports, so many things. But we know for first and foremost, that is not the case for a large majority of moms out there.
Yeah.
So on that note, let me get into some of those barriers that I mentioned earlier that are really preventing women from taking or getting timely treatment for themselves and their families. So first off, as with most mental illnesses, there is a significant stigma and shame associated with it. So this is all added to the high expectations that society already places on new moms that makes it they just want to hibernate and hide and never leave the house. And so, of course, you're not going to be like, oh, yeah, that's me. I want to get into this whole discussion about my own mental health.
Right.
And, you know, what that even means to my ability to care for my kid. Like, I can't imagine how scary that would be. So actually, I can't imagine. So yeah, that's number one, why people aren't getting the help they need, because it takes them too long, or they're not feeling like it's a safe place to be able to share that information. The other one is a huge lack of awareness. And I think we've beat that horse to death in the amount of a surprise that nobody knows, have common knowledge of PMADs, and how so many women are unaware of the differences between that and the baby blues and, just the general hormone fluctuations. Yeah. So something that we need to know, and just general awareness of the services that are available. That exist. Which we're going to get into. Another thing is limited access to support services, just in general. So there's things like long wait times to see a mental health practitioner. You have to get referred. You have to have a family doctor. You have to see them. You may have problems with transportation or childcare to, watch your baby while you're going to these appointments. There's so many pieces of the puzzle, and a lot of these support system services, it's not easy to access them. They don't come to you. You have to go to them, and you have to go through a bunch of hoops to get that appointment.
Yeah. I feel like we obviously both work in marketing or like have marketing experience, and like customer psychology says like remove barriers to like checkout. Right. Like they're like only, you know, like
less
don't add
clicks.
Yeah,
like,
less clicks, all of this.
Yeah.
And like I feel like with this, there's like so many added barriers that you're like, okay, first I have to go to my family doctor. Okay, now I can't get into my family doctor for like a month. And then I have to get a referral, and then that referral like leads me here. But then I like, what if I can't get into that?
Right.
Anyways,
and then it just adds to the anxiety of everything, right? It's like, oh, I can't see someone in time. What's going to happen to me?
Exactly.
To my baby?
Yeah.
Like,
it's insane.
Yeah. And then you add in people who are new Canadians, are immigrants who have cultural or linguistic barriers, don't even speak the language. They're away from their home country. They're away from the support system. Can you imagine what it would be like to be in a place where they don't speak your language? You can't even explain to them how you're feeling.
Yeah.
Because there's not a lot of support services that even are offered in general, let alone in different languages.
Exactly.
Like how isolating that would be. I can't. Financial constraints are of course always a thing. It's hard enough being on maternity leave with who knows what kind of supports you have financially, whether it's top up or just you're on EI or who knows, but it's not much. And, you know, a lot of these mental health providers cost money. It's not covered in your insurance. Do you even still get insurance while you're on mat leave? Who knows? There's all of those things to keep in mind. And of course, diapers, formula, cost $1 million these days. So let's be honest.
Yeah.
Where are we going to prioritize? And last but not least, and this is a big one, no surprise here, is the inadequate screening and identification of PMADs in general. This in itself is one of the biggest barriers that prevents women to getting timely support that they need.
The timely support.
Yeah.
Is so important.
Yeah.
Oh, so many things, most of which I totally think could and should be addressed in very short order with some direction and financing from those folks in government. Thankfully, it is an election year for us, both provincially and federally, even actually municipally as well. Like
there you go.
Locally. We have so many ways to have a say. And I bet I know who can fill us in and shed even more insight on this topic, our special guest. Today, we will be welcomed by Lynn Carr of the Regina Early Learning Center's Perinatal Health Network. For those who don't know about the Regina Early Learning Center, it's a family and child development center in Regina that works with families to foster the healthy development of children from the prenatal to 5 years of age. They do this through a variety of educational programs for parents, preschool support, and they offer a free early learning family resource center and, of course, the Perinatal Health Network where Lynn works. So without further ado, let's invite Lynn in to chat more.
Welcome, the lovely Lynn Carr.
Welcome, Lynn.
Welcome. Lynn is the Regina Perinatal Health Program Coordinator in our hometown in Regina, Saskatchewan. And we're super excited to tell you more about Lynn and get into picking her brain with all sorts of things on this topic. She lives in Regina with her husband and 2 children aged 8 and 6, and currently is in the final semester of her Bachelor of Social Work degree at the U of R. Lynn also has specialized training in perinatal mental health from Postpartum Support International, supporting survivors of sexualized violence from the Regina Sexual Assault Center, and applied suicide intervention skills from Living Works. She also possesses education in grief loss and community healthcare through a social work lens. Lynn's passion for accessible maternal mental health care stems from her own journey with perinatal anxiety and depression after the birth of her son in 2017. Drawing from her personal experiences and professional expertise, Lynn aspires to provide social support in a non-judgmental environment, alleviate the mental burden of motherhood, and offer community resources and connections to ensure parents never feel isolated in their journey. Thank you, Lynn. Wow.
Thank you both for having me. Where were you? Like 2 years, like 3-4 years ago.
Yeah. Or, I mean, I'm sure you were around, but we just didn't know.
We didn't know about you.
That is exactly it. And it's very common even today when I meet with new parents and they'll say, I really wish I would have seen you throughout my pregnancy. And I'm not surprised, unfortunately, but I'm glad you're here now.
Yeah.
Maybe not glad, but I'm grateful that you found me.
Yeah. And you can be supportive in that time.
Exactly.
So, well, before we dive into the nitty gritty stuff, we have some rapid fire questions to like, just, loosen us up a little bit, loosen you up, I guess. So the first question, and one of my faves is always, what is the best piece of advice that you've ever received?
Well, I would say the best piece of advice I've ever received actually came from one of the moms that used to come to my support group before she went back to work recently. She was always very supportive of everyone there. And I remember there was this moment where we were chatting about setting boundaries. And she says, no is a full sentence, full stop, just no. And I've carried this with me for over a year now. So in terms of boundaries, I've just found it really helpful for remembering that I don't need to provide a paragraph explanation as to why I want to say no. And it's not my job to convince the other person about why I'm saying no or why I'm uncomfortable with something. Now, obviously, there's going to be times where you do give a bit of an explanation, especially when we're talking with kids about working with boundaries.
Right.
But the underlying message is just, no, this doesn't work for me, but let's have a conversation about what does.
Right. Giving options. That's a nice way to do it.
Turn the script and educate. Like,
Yeah.
how about,
Yeah.
I like that.
I am such a big, I'm working on building boundaries.
Aren't we all?
I'm like just an absolute people pleaser. But the no being a full sentence, like full stop, period, point blank, is so empowering.
It is.
And without, and like, especially I feel like in text messages where you're just like so accessible at all
Yes.
times. And you can just be like, no, and then just put your phone in. I'm also really bad at just like putting my phone on do not disturb all the time.
Yeah.
And then being like, I'm just not accessible right now because I will look at it and try to, people
It's
please.
hard not to, though.
Yeah. We're so conditioned.
Yeah.
Okay, next question. If you could grant one gift to all women, what would it be?
I would grant the gift of self-compassion.
Ooh.
I see it so often where people are really kind and compassionate and would do anything to help their friends and family who are really struggling, but they can't turn it inwards.
Yeah.
So with self-compassion, you are not only giving yourself kindness and grace, but you're also understanding that you're a human being who will sometimes make mistakes and struggle, but you still deserve to be comforted and taken care of just like anybody else would.
That's beautiful.
Yeah. We haven't heard that one yet. We
No.
ask this question a lot.
No
and I love
way.
that. And I'm surprised we haven't actually.
Yeah.
That's huge.
Yeah. It's very, I think especially as moms, that's very
Yeah.
hard.
So much guilt out there.
Yeah.
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 Okay, last question. And I think always our absolute favorite is what is your scary?
Oh, I feel like I have a couple, but
That's okay. We'll allow
I
it
think-
if you have a couple.
I think they're really intertwined though,
Okay.
so bear with me.
Okay.
I often think about the limited discussion around maternal mental health, as well as the limited, timely, and accessible perinatal mental health services. So a lot of the individuals I meet usually have to wait a month or longer to get in to see a counselor or specialized care. So because at our PHN, we offer the free weekly support groups and the individual sessions, I tend to meet people right when they're really in the thick of it. So it's tough knowing how isolating living with a mental illness can be and how a lot of people suffer alone in silence for a variety of reasons, like no support system or limited support system, or they just have a lot of experiences being invalidated by those around them. Mm-hmm. Yeah. And then it's also really tough for me because I want to provide this wraparound care that I think everyone deserves. But for those of us in the maternal mental health field, we know that there are far more people needing services than we have immediate capacity for. So it really breaks my heart that I hear of some of the stories of the families that I work with and what they have to navigate by themselves. So that's really why I'm here and
Right.
why I want to walk beside them and help them in their wellness journey and just connect them with professionals and counselors I trust as best as I can to help fill this gap.
Yeah, absolutely. I told a friend who is, I would say recently pregnant. She's about 14 weeks pregnant.
Amazing.
That you were coming tonight. And she was like, does she help with people who are like pregnant right now? And I was like, yeah. And she's like, please send me this episode so I can listen to it because she's just struggling. And I think that it's, like people, especially as well, not everybody, but when you're kind of newly pregnant, it's like exciting and everyone's like,
Yes.
yay, you know, you're buying all this stuff. And she's like not doing well,
Man.
which is hard. Yeah. So
It is. And that is why I wish more discussion around the pregnancy side of things and how it really affects our mental health can go. Because if someone does find me prenatally, we have so many discussions around, I wanted this. Why am I not happy? Or I tried so hard. I tried so many times for so many years. Like, I should be grateful, but this is literally the worst because I'm getting sick every day.
yeah.
And it is just really hard.
Yeah.
And I'm sorry to hear that your friend is really struggling right now.
Yeah. I mean, and hopefully she's listening to this and we'll get something out of it. But okay, well, since we're already kind of getting deep into it, let's just dive deeper.
Perfect.
So this is a kind of a big question, but tell us about your journey to becoming the coordinator for the Regina Perinatal Health Program, and like include some things about for like what is the program? Like what is it all about? What drew you to this role, and what do you enjoy most about it?
That is an awesome question.
Lots of questions.
I'm like, okay, so here's one question with 7 follow-up questions.
No, I love it because I'm a talker and
Okay.
I feel like I would have said all those things anyways.
Okay, great.
this
So we're
is
just
great.
prefacing it.
So my interest in maternal mental health started after I experienced postpartum anxiety with bouts of postpartum depression after the birth of my son in summer 2017. So at that time, I really struggled with finding postpartum mental health resources. And when I did find support, I felt like I had to jump through hoops to receive adequate care. And I found that there was very little discussion about perinatal mental health within my primary care team. And then any information I did receive were symptoms related to depression. Nobody talked about the anxiety side of things. So that lack of conversation
Right.
around the anxiety, the intrusive thoughts, and the rage left me feeling really isolated and honestly scared to talk about how I was feeling with other people. So eventually, thankfully, I got help through therapy and medication. And eventually I just reached a point where I wanted to work in this area and try to fill some of the gaps that I experienced. So then that's kind of when I started following Sarah Beckel's work. So she has worked tirelessly in Regina over the last several years to bring awareness to perinatal mental health, both in her work as a doula, as an advocate, and then eventually when she opened our PHN in 2020. So in spring 2021, I got involved in a charity walk that she was hosting with our PHN. And then in fall of 2022, I saw that they had listed a part-time facilitator job, and I just decided to go for it and see where I landed. And thankfully, Sarah saw something in me of value, and she brought me on and she mentored me, and she's been a really solid support for my facilitator work in this area. So then when she had to take a step back about a year ago from our PHN, I just felt like it was really important for me to step into that coordinator role and just continue on her work that she had started.
Amazing.
Yeah. And then the goal of our PHN programming and support is really just to provide that safe space for anyone to talk about what they're going through, validate their experiences, and in that judgment-free space. So we do this by the weekly free support groups and the free individual support sessions each week. We also work diligently to increase awareness and reduce the stigma surrounding the perinatal mood and anxiety disorders. We provide educational presentations to organizations that request it. I also have a number of community resources if parents are ever looking for like clinical therapy or seeking medical professionals with experience helping perinatal clients. I also keep a list of other postpartum resources like blogs and podcasts and mom and baby activities to do in Regina. And I just want to make sure that new parents stay connected to their community and find accessible ways to get out of the house periodically, as this can really help mitigate the feelings of isolation that can come with having a newborn at home. And then the best part about my job, I'll end on the high note, the best part about my job is really just having the chance to meet with so many amazing, wonderful parents who in turn send their loved ones my way for support. And just that feeling of making a difference, even if it's small, it's really rewarding. So I feel really lucky that people are allowing me into their space and they're trusting me with their stories. Yeah.
I think that's absolutely incredible. We talk so much. I mean, Raise Her community is all about community and all about collaboration. And we very much so understand and recognize the power of community from like the point of like advocacy for women, but also from the point of like being new moms and like needing each other, and like even like the community that Skylar and I hold just together of like having another person to rely on that's like not your partner, not you know, other people, is so huge. And I always think about those women who, or like parents who don't have another person, if they're here alone, or if they're just whatever, if they're removed from somebody for whatever reason, and it's like, oh, that's so isolating.
Imagine.
Yeah.
I have 2 follow-up questions to that first question. It just popped in my brain when you were talking.
Perfect.
The first is, are you the only perinatal health program in Regina or in Saskatchewan, or is there other ones?
We are one of the only free programs in Regina. There are a couple of other programs that have popped up in the last couple of months in Regina. And then in Saskatoon, there is another program, Mother May I, that does very similar to what we do, offering that peer support space. There's also a couple of other places, like in Swift Current through the Family Resource Center. They were hosting a mom's group. A lot of times, though, it's not specific to the mood and anxiety disorders.
Okay.
So in terms of that, we're pretty specialized in that area, because like mom groups are so wonderful. But if you're experiencing a mood or anxiety disorder, there's a lot of things that you feel like you're being judged for. 100%. And a lot of times it's not reality, but it makes it really hard to get out of the house and get into those more generalized mom and baby groups, because you're so anxious about what other people are thinking about.
Yeah.
So to have that dedicated space specifically for the mood and anxiety disorders, you already have that out of the way. As soon as you walk in the door, you know that everybody in that room is navigating something similar to what you're going through, and it can really lift a weight off your shoulders.
Huge. Absolutely. Yeah.
Okay, and my other question was, is this just mom-only programming, or is it parents, like both partners can attend?
So my support groups, I typically meet with just moms and birthing people, but my individual support sessions, I have met with both.
Oh, nice.
Especially prenatally, I've actually had both mom and dad come in, or mom and partner come in, and it's really great when we can have both. If they're both going through it, then we can kind of tackle both. But if it's one person that's going through it and the support person just wants more information, it is really, really amazing to have those conversations with the family as a whole, because we know that family well-being is integral.
For sure.
Right?
Yeah, absolutely. Yeah.
Wonderful. It blows my mind that this is all so new still. Like you said, 2020 was when this started.
Yeah.
And even the whole mental health day, maternal mental health day, is like recent too.
It is.
Like what was going on in the past million years?
Yeah, it was essentially frontline workers or doulas or people that were working in other birthing areas that just either had the lived experience or they knew somebody that experienced this, and so they were just trying to tackle it the best that they could in the field that they were in. Right. So then we didn't start connecting the dots and seeing like, oh, this is an actual thing that we need to address. And then now we're slowly but surely trying to fix that.
Thank the Lord, honestly.
Yeah.
Okay, back to the program questions. Can you share some insights into the prevalence and common types of maternal mental health issues that you've seen it be experienced during that perinatal and postpartum period?
Yeah, so it is estimated that 1 in 5 women and birthing people will experience the perinatal mood and anxiety disorders, or PMADs, either prenatally or postpartum. And then 1 in 10 fathers can also experience the PMADs, which increases to 1 in 7 if the birthing partner is also experiencing symptoms. And then Indigenous mothers are 20% more likely to experience a perinatal mood disorder compared to white Canadian mothers. And 40% of Black mothers experience these disorders every year as well. There's also currently limited data on the prevalence of PMADs amongst immigrant refugees and families in Canada. And there's also limited research on the PMAD experiences in the 2S LGBTQ plus community. And so in terms of disorders, they can range in severity, and they include things like depression, anxiety, panic disorder, obsessive compulsive disorder, bipolar disorder, post-traumatic stress disorder, and then in extreme cases, postpartum psychosis. And one misconception is the baby blues.
Right.
These are different from baby blues because they typically don't go away without treatment. They interfere with your ability to care for yourself or for others, and they last longer than the first 2 weeks postpartum.
Right. I was just say interesting because I'm recently, my baby is 15 months old. So recently back to work from a mat leave.
Yeah.
And, I just feel like there is no education whatsoever. There's so much talk, and this is my second child, but even with my first, I did Sally's class, and you learn all about the stages of birth and what's happening in your body when you grow. But there is no discussion, no warning of any of this.
I know.
And it's so common, like you said. I don't understand why.
It is, yeah. And I know there are some prenatal education classes out there that are now talking about this fourth trimester or the hormone changes and the mental health side of things. So they are starting to do this stuff in prenatal education classes, which is really great. But you're absolutely right.
Like it's just starting now.
It's just starting now.
Yeah. I think even so many of the books and things and different things that I read before becoming a parent was so much about what's your body doing for the baby and what's happening with the baby. And and then when the baby is born, here's what the baby needs. But it's never what does the person providing all those needs to the baby also need? Because people come over and they're like, I'll hold your baby. And can you get me a snack? Yeah. And you're like, actually, I'll hold the baby and you give me a snack.
I honestly, what a world we would live in if that was the standard of holding the mother. And then she holds the baby.
Yeah.
You know what I mean?
Yeah, absolutely. It would make such a difference. And I think having conversations like this and having even it be part of the prenatal courses and different things and conversations are obviously going to start to change the narrative. But the fact that I went through it and I was like, this is BS. And obviously I'm just a little privileged princess. So I can't even imagine everyone else who's gone through this without the supports that I even have in place, you know? So it's insane. Okay. Anyways, I'm on my soapbox for a second. Okay. So you talked about the different mood disorders and all the different things that you can commonly see or uncommonly see. But what are some of the most significant factors that contribute to perinatal and postpartum mental health challenges?
So there's quite a few.
Okay.
Actually.
Hit us with them.
So this list isn't exhaustive.
Of course.
But most common is a history of depression, anxiety, OCD, or any other number of mental health challenges, or previously experiencing a perinatal mood or anxiety disorder. There's also a history or currently experiencing any sort of trauma, whether that's domestic, verbal, sexual, poverty, or even traumatic loss. Things like a history of diabetes, thyroid disorders, premenstrual dysphoric disorder, experiencing a stressful event in the last year like job loss, recent move, divorce. Single parents or individuals with limited support systems can impact being away from your home country and the support system that you had there. If you're experiencing a high-risk pregnancy, giving birth to multiples, or having a history of miscarriage, or if there are any health challenges either in the parents or having a stay in the NICU at all of these things can impact. But with that being said, not everyone that's experiencing these things will necessarily develop
of course
a mood and anxiety disorder.
Yeah.
But likewise, even if somebody isn't experiencing any of these things, they can still develop the mood or anxiety disorder because they don't discriminate. They can happen to absolutely anybody. So especially in terms of prenatal appointments with our doctors, you know, they go through questions, what's going on for you? And if people are saying, no, none of this stuff is happening for me, that's when people get missed because they're not flagged as being at risk.
Right.
Right.
Yeah, as you said, any mental illness does not discriminate against anybody. And it's not anything that you did to not deserve, but be placated with a mental illness.
So basically everyone and anything can cause it. It's just
honestly,
matter, really, what's happening. It's a high likelihood. You said 1 in 5, right?
1 in 5, yeah. And that's kind of like pre or early pandemic rates. So today, it's most likely to be more than that.
Yeah. For sure.
So I would be interested to see once we start, you know, updating some of the research over the last few years and look at post-pandemic rates. I would be really interested to see how these rates have changed.
Well, also maybe even people realizing that they're in it. Like, you're not going to self-declare that you have dealt with anxiety if you don't know that that was actually anxiety and not just like what you're supposed to think is like normal in pregnant or like in postpartum or anything.
Yeah, absolutely.
Yeah. It's the naming, right? And if you've never gone through it, you don't, you know, your brain is actually changed after you have a baby and you don't know, like you said, the baby blues versus it could be more, but there's no education on the difference. Yeah. It's like, I don't know. And also you're sleep deprived, everything else. Like it could just be, I'm tired. I don't know. Like it's, and then to top it off, your support network, your moms, your aunts, your grandmas, all the people probably didn't have this education because it didn't exist. So they're not really helping, like, you know, it's not really coming from someone else, which is really unfortunate. So
yeah, it is. And it's a really common topic of conversation, I would say, is the welcome to motherhood. That's just motherhood. Mom's worry. And no, it's so much more than that.
Can you share some of the outside factors? So we talked about some of the predisposition or, you know, situations, life experiences that could make you more at high risk for these disorders. But what are some of the cultural, societal, familial factors that may influence maternal mental health?
There's quite a few intersecting
so more everything.
I feel like that's my standard answer. Yeah. There's a lot.
Yeah.
So something that I speak with parents about frequently is how their close family and friends view mental health and mental illness. So in families where it wasn't talked about or it was minimized, we see a lot of that shame and guilt from parents, like, why am I feeling this way when my baby is so perfect? Or they'll tell me about how their relatives said they had debilitating anxiety. Oh no, it's just regular mom worry, and welcome to motherhood.
Ugh.
Yeah. And socially, I think we all see those social media posts or hear from someone in our circle, like, you wanted this, you should be happy for it.
I just want to punch through the screen when I see it.
You need to enjoy this 100% of the time at 110% capacity. And it's just really invalidating that these are the main stories that we hear growing up and all throughout pregnancy. And just experiencing a mood disorder, it doesn't make us any less of a good parent. It just means that we need a little extra support and encouragement, which I would argue we all deserve.
Oh, yes.
Yeah. And I mean, from a cultural perspective, many people grow up with this Western worldview of everything stays in the immediate family. We don't talk about our stuff to strangers. We certainly don't burden other people with our problems. And this type of individualistic thinking is really harmful to families because we think we need to be able to do everything ourselves when historically that wasn't the case. Like, our grandparents had the neighborhood come around, bring casseroles. They're supporting the new family, right? And we don't get that now.
No.
So I actually read a really interesting news article the other day about a great nonprofit in Calgary called Porridge with Love. And it's ran by the Immigrant Outreach Society and modeled on traditions from Ethiopia. So a group of volunteers, there's usually about 15 of them, gathers and they have a special ceremony in the days following birth. And then they all sign up in shifts to cook, clean, take mom and baby to appointments, and just be there for the family. And this type of wraparound care is so huge when treating and preventing mood and anxiety disorders. And I just wish this was the norm. Yeah. And I'm hoping that by that article coming out and me talking about it, I'm hoping there's somebody out there listening that's like, yes,
I'm gonna do this. Yeah, please, for the love of God. I'm like honestly on the verge of tears because this just sounds so incredible. Like this is what people need. And I mean, even like I know that it's Ethiopian, you said. There's so many worldviews. We had Lori Campbell on recently who talked about like matriarchy, and that is the matriarchal view of society, especially in Indigenous cultures. And like, I mean, I'm even trying to be like, every single person that my son encounters is like auntie or uncle. I mean, if they're like safe, obviously, because I'm like, these are your people. Rely on these people because, you know, it's not just like your immediate family that who is in your community and who is going to care for you. It's like everyone. And it takes a village, as we say all the time.
100%. Yeah. And I mean, in Regina, there is a really great nonprofit that's just kind of getting started in the last year, and it's Build a Village. And that's the goal, is helping families with anything. Like they'll come and watch your kiddos so that you can go out for a date night, or they'll cook or clean and just be that hand. And it is tough because right now it is a paid for service, but you know, eventually it would be amazing if they got enough funding to make it free and accessible for everybody, right?
Yeah. Amazing. I've not heard of that.
We will find it and put the link. We're going to share about it. So, okay, we talked about the societal and cultural and familial factors. What are some of the early warning signs or symptoms that pregnant or postpartum women or birthing people and their support networks should be aware of regarding mental health issues?
I would say the most common, or some of the most common symptoms anyways, would be feeling completely overwhelmed, waves of sadness or guilt, not feeling bonded to baby, or that baby might be better off without you, feeling numb and disconnected, problems focusing or concentrating on tasks, ongoing sleep problems, difficulty eating or drinking. There can be intrusive thoughts or sudden bursts of anger or rage. And then there's also physical symptoms like headaches, nausea, chest pain, racing heart, dizziness. Prenatally, you might notice things like hypervigilance with food. So they might get to a point where they're so hypervigilant, it's impacting their nutrition and their overall health. And they may have intense fears related to fetal development and over research and like really go down rabbit holes there. Postpartum, it could look like a really rigid schedule, hyperfixating on naps, not driving for fear of getting into an accident, or just being consistently more irritable than usual. And normally medical professionals will say that these need to persist for longer than 2 weeks before you reach out for support. But honestly, I think if these symptoms last for longer than a couple of days and they are just really out of the norm for you with no obvious reason behind them, it's worthwhile to have a chat with a professional about it. Don't wait the 2 weeks and suffer for the 2 weeks, right? And yes, sleep can absolutely impact mental health, and that should be considered here, but these symptoms don't generally go away with adequate sleep and nutrition. So if you're getting the best sleep of your life and for 3 days you're still just in the thick of it and just miserable, reach out to somebody.
Honestly, it's so annoying because we just talked about this last week, but like after you have a baby, obviously your hormones are like, whoa, like they go insane. And so I mean, a woman experiencing or a person experiencing a period or like menstrual anything, as you go through it, or like menopause, your hormones are already like, whoa. So you're like irritable, you're sad, you're everything. So then you kind of start to attribute, you're like, maybe it's just my hormones. But then on top of it, if you have all these other things coming through, but then often healthcare providers, not often, I'm not going to throw everyone under the bus, but they're like, you're just hormonal.
Yeah.
You know, you get that. And you're like, I really don't think I should be crying all of the time.
Yeah.
Yeah.
Yeah, absolutely.
Like, it sounds like me now. Yeah. Maybe I should talk to somebody. I'm like, it lasted way longer than 2 weeks. But a lot of those things are like me in a nutshell in general. So I feel like there's got to be a quiz out there that we could like send people to be like, is this, because I know I had like the written checkbox quiz that
I'm
you
like,
take.
I'm 4 out of 5.
Yeah. And it's like, okay, if you got like, I was like one under the official, like I should see someone for my last, like for perinatal or postpartum anxiety.
Yeah.
But I'm like, that's like a 10 question quiz. Like, really? I don't know how that accurate that is.
It is. And most of the questions revolve around depression.
Yeah.
There aren't a lot of anxiety related questions in there, which is really tough. And then I think even just the number threshold in general. Okay, yes, if you scored under their threshold, I guess, for support services, you still scored more than 0.
Yeah.
Right. Yeah.
Right? So you should still be offered the support. Because when you're sitting at somebody's desk and you're filling out this questionnaire and they're staring at you, are you going to fill it out honestly?
Yeah.
Right? Or are you going to maybe undervalue some of your things because you don't want to seem like it's as bad as it is?
Right.
And I feel like that's the only thing they ask you as a mom about you.
Yeah.
Everything else is, how's the baby sleeping? Let's wait. Da, 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 da.
Yeah.
Yeah.
But after that, it's like, okay, you passed that, but not, how are you doing? Are you getting support? Da, 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 da.
Yeah.
Nothing.
Yeah.
No other questions.
No.
Yeah.
Checklist done. Then you're done, kind of thing.
Yeah.
God.
And it's unfortunately more common than it should be that screening gets missed. Me personally, it was missed. I mean, it didn't happen prenatally, and it to my knowledge, it doesn't quite happen prenatally now unless the professional has experience in this area, then they'll do it. But for me, I didn't get it at the 2-month vaccine appointment or the 4-month visit. And the 6-month visit was extended to 7 months because we were sick and all of these things. And it wasn't until that appointment at 7 months postpartum that the nurse looked at me and said, "How are you doing?" And I burst into tears. I sobbed in her office, and it almost seems like a rite of passage that like you need to cry in public health's office at some point, right? And then she did the screening with me because she opened my file and said, "Oh, nobody's done this with you. We need to do it." So we did it. But then the unfortunate thing is that I scored too high to be referred just to their maternal wellness program. I had to go through my medical doctor to get a referral and get them in the loop and everything. But I didn't have a family doctor at the time.
Oh, God.
Yeah, I didn't have a family doctor at the time. And obviously I had an OB that was overseeing my care, but being 7 months postpartum, I wasn't on their list anymore.
Yeah.
So before I could access care, I had to find a family doctor and talk to this person about what I was going through and disclose all this stuff just to be able to get the help that I needed. And it took almost a month to get into that referral and start getting those maternal wellness phone calls. And it was a lot.
Yeah.
It was. And I've heard it's gotten better than that. And I sincerely hope that's true. And I know that those nurses do the absolute best that they possibly can. And really their hands are tied when it comes to policies like these, right? Like they have to follow the policies, even if they don't necessarily believe in them or know that there's a better way. But moms fall through the cracks sometimes.
For sure. Oh, yeah.
And then babies do too.
Yeah,
right? Like,
absolutely.
They'll go hand in hand. So talk a little bit about the long-term impacts of, like you said, you were 7 months postpartum when you got some help. What happens if it goes longer? Like it could be years. What are the impacts or the lasting effects on that for women?
There's quite a few. So obviously it can impact how parents bond with their babies. It prolongs maternal depression or anxiety for at least 4 years after childbirth. And in extreme cases, it can lead to maternal suicide or infanticide. It can also impact parental decision-making and increase parent relationship conflicts. And these PMADs during pregnancy can also have the long-term effects on infants, like preterm labor, low birth weight, or a disruption in brain development and other organ systems. And then this disruption of healthy brain and system development can result in things like childhood learning impairments or behavior difficulties such as ADHD. And it also can increase the risk of diseases like heart disease or diabetes. So given these risks associated with leaving the mood and anxiety disorders undiagnosed and untreated, it's so important for birthing professionals to understand and talk to clients about the PMADs as soon as possible. I would love it if it was prenatally so that they could plan accordingly. And then to anybody listening, I just want you to know that you're doing the absolute best that you can. And that's what matters. These long-term outcomes can be mitigated with treatment. So I don't want you to feel like you're failing here if you're experiencing these symptoms, because with treatment and help, you can mitigate these things.
It's absolutely, again, insane. I had such intense prenatal anxiety that I developed PVCs, like my
oh wow
heart.
Yeah.
And I still get them now to this day. So my son is 3.5.
Wow.
And I still get them because of whatever was happening.
Yeah.
And I know when I'm feeling anxious, because then I start to get them, and it's like, then you're very aware that your heart is beating, and you're like, should I feel my heart beating?
Yeah.
And it's just a whole crazy thing. And so like even the fact of like on your child, the symptoms can obviously reflect, but like also your mental wellness also can impact your physical wellness as well.
Absolutely.
Yeah. And so it's just all tied together. It's all great. Okay, well, we've talked a lot about the like downsides, the dun-dun-duns of it all. But can you share any success stories from those who've gone through your program, or how the Regina Perinatal Health Programs has made a positive impact on maternal health at the community level?
Yeah. So I gauge success just in terms of the amount of referrals that I receive and how often I hear our PHN being recommended in the community. I think other mental health professionals that can agree that we don't always hear that dedicated feedback to whether we're doing a good job or not. But what I can say is I have had many past and current parents sending their prenatal and newly postpartum friends and family my way. I also receive a number of referrals from public health offices and private clinics. I also have several parents that have reached out a few months after going back to work and ceasing services, saying they really valued our space and how important the validation was. And I think that's just really incredibly powerful. And I'm also at a point where I'm collaborating with other like-minded professionals and being asked to speak more publicly on our support services with businesses and health services around Regina and beyond.
And podcasts.
So I like to think that this means the community finds us valuable and knowledgeable in this area. So I would say that's successful.
Hugely
Absolutely.
successful.
Yeah.
So we have a couple more questions, and we're learning so very much.
Yeah.
Thank you so much. Do you have any effective strategies or interventions that you could recommend for preventing and treating? I know this is a loaded question, and it probably is very individual,
Yeah.
but just in general, preventing and treating perinatal postpartum mental health issues.
I would say the biggest prevention and intervention strategy is having a mandated screening protocol for the mood and anxiety disorders and coordinating support efforts across disciplines. There's several organizations throughout Saskatchewan and Canada that advocate and meet with government officials to call for this mandated screening program. We're not quite there yet. And then because this isn't mandated and it's not universal in Canada, it really is largely determined by practitioner knowledge and training. So there was a study done a few years ago by Canadian Perinatal Mental Health Collaborative, and a large number of medical practitioners in that survey said that they have not received specialized training in perinatal mental health, nor do they have mandated screening programs in their clinics. So unless they have experience in this area or they personally know someone that has,
Right.
they may not be aware of or screen for PMADs, which is really unfortunate. And I think some really beneficial intervention strategies beyond that is a combination of services, whether it's medication, clinical therapy, social support, that wraparound care that I spoke about earlier. The important thing here is that the treatment needs to be timely and accessible, which unfortunately isn't always the case.
Right.
You know, there can be gaps between prescribing professionals and mental health professionals. There's often long wait times to get into publicly funded mental health treatment. I know the majority of parents I meet with wait at least a month to get in to see someone. And that's if they're not already seeing someone. And it can feel really inaccessible when you're in the thick of that perinatal fog. There are some really great medical professionals and counselors that are well-versed in maternal mental health in Saskatchewan. So I try to keep a list just to give to parents that are searching for clinical support so they don't have to navigate the mental health system in Saskatchewan alone. I hear from parents a lot that it's tough to find someone that gets them, or how discouraging it can be to have to educate the person that you're meeting with on perinatal mood and anxiety disorders. So I just want to make sure that people feel supported and empowered in this area. And then there's also a really big misconception that people experiencing symptoms of PMADS will openly talk with their care team right away. But we know social stigma, that is not the case. This stigma really impacts whether someone discloses what they're going through, even to their friends and family. So this is where the importance of social support comes in. So organizations like myself, and in Regina, there's a new mental wellness center that's opening, the I Love You More Wellness Center. And it's all about that social support and providing it regularly and creating a space to normalize conversations around mental health with others. And it's also just a really nice opportunity to meet other parents with young kids and hear how different families navigate parenting challenges.
Two things that you said, but one specifically is on, again, no shade, but to family doctors who are really just like, I want to say like jack of all trades. Like they know like a lot about a lot of things, or I would say a little about a lot of things. But like, if you really dive deep into something and you're like, okay, like I'm this very specific person who is like a mood and mental health or mental illness, but like I also just had a baby, which is different. It impacts, it's a different thing. And if they're like, I don't know, or like they just try to treat it with like the same brush strokes, then you're not getting the care that you need.
That's exactly it. And especially when you're talking about things like the parent guilt and the shame, that can really impact levels of depression and anxiety. And it's hard to explain that to someone that's treating depression or anxiety from just like a generalist lens.
Right. So different.
Yeah.
Okay. So then, and you also talked about the stigmas that exist. So I want to dive a little bit deeper into that. So how do the stigmas and misconceptions surrounding maternal mental health affect access to care and the support for affected individuals? And then how can we as a community support with ending changing and like stigma, breaking it down and changing that stigma?
Unfortunately, the stigma and the misconceptions do really impact in a lot of different ways. It really makes us reluctant to report our symptoms. The fear of being reported to Child Protective Services is a lot more common than you would expect. And there's also just being unsure if the symptoms we're experiencing are part of the regular hormone changes that occur during pregnancy and postpartum. And then environmental factors can influence an individual's ability to seek and receive treatment, like during the pandemic lockdowns and time-limited appointments where everything is focused on baby. Or you know, living in rural communities where there aren't a lot of specialized services nearby, you really have to rely on virtual services. What if you have spotty Wi-Fi? Right?
Or like even a phone call, doctor's appointment is so different than seeing them in person.
Absolutely.
Like they have their time and place and they're great if you're like, I just need a prescription renewal. That's all I need. But you're like, I'm going through something.
I need you to see my body language. Because my words are probably not going to match the way that I look and feel and present.
Exactly.
In terms of marginalized communities like 2S LGBTQ communities and Black, Indigenous, and people of color, they face the added barriers like medical sexism and racism, a lack of culturally informed care. There's biases among healthcare professionals and colonialism. And there are so many documented cases in the news and so many more that are undocumented of just the really unfortunate and unjust ways that they're being treated in this system. And so I think as a community, the biggest thing that we can do is keep telling our stories, be aware of current trends in maternal mental health, and being aware of and sharing support options as commonly as you would recommend a restaurant to a friend, right? The more we talk about maternal mental health and perinatal mood and anxiety disorders, the less mystery it has and the less isolated people will feel. And my hope is that if we keep these conversations going, maternal health support will become so commonplace. It's just a regular topic of conversation throughout prenatal and postpartum visits. And mental health support plans will just be integrated into perinatal wellness plans. That's like ultimate dream goal.
I love this.
Me too.
I love this dream.
Totally. Okay, last question. And this is just general. What do you think we can do? How can we help as individuals? We talked a little bit about healthcare providers and kind of this and the systems that we need in place and the screening and all of that. But really as individuals, as a community, as a village, what can we do to help those moms?
There are a lot of really great ways, both like personally and in your professional life, that you can really help in this area. So like I said, just continuing those conversations in your communities and normalize seeking treatment. You can also join mental health awareness walks in your community. You can donate to local nonprofits and community organizations that offer perinatal support services. If you're working in healthcare or the mental health system or really any related discipline, you can stay informed of new and upcoming research and trends in maternal mental health. And you can also find training in this area to keep your knowledge current. If you're working in public policy, you can be aware of current policy benefits and harms and advocate for maternal mental health policy reform in Canada. And then I think most importantly, just having the patience and grace for anyone that is impacted by the mood and anxiety disorders. And as a professional, staying humble by knowing your limits and referring clients to practitioners and organizations that are educated in maternal mental health. This just really ensures that parents are receiving the best possible care for their specific needs.
And not a lot of hard work, really. Like it's just simple things that we can all do. That go a long way.
I feel like we talk often about policies, but you had already mentioned it. Like there's sometimes nurses or healthcare providers or whoever feel so limited by the policies that are put in place and like the rules that are set up around them. Yeah. So policy makers, policy changers out there, please do something.
Help us.
Help the situation. You have a lot more sway than I think most people realize.
Yeah, absolutely. And I think you really nailed it when you said like these are maybe smaller things that you can do, but they create waves once you get going. Yeah. So I would just encourage you to do the small things. It's still making a difference. Even if you can't immediately see it, you're still making a difference.
Lynn, thank you so much.
Yes,
this was absolutely amazing. I feel so empowered. You dropped so many resources. Yes. I hope everyone listening is like, wow, like I'm going to send this all to my pregnant friends and new moms. Is there anything else that you want to say, wrap up?
I guess I just want to make sure that I know I probably missed some folks that are doing really great work in this area. And I promise it is not because you're not doing a good job. It's because I get nervous and I'm a human being and sometimes I forget.
Yeah.
So if you are a perinatal mental health organization or person, or you know of someone in your community that is doing a really great job in this area in whatever capacity, I would love to know about them and connect with them and promote them to the best of my ability, because it really does take a village to raise a family.
Yeah. Thank you
so much.
Thank you for having me.
Wow. What a fascinating discussion
Honestly.
with Lynn. Holy moly. I still cannot fathom the fact that so many moms are undiagnosed out there and unsupported and are left having to go on as normal, quote unquote, and battle the twilight period of raising a baby. Like absolute bonkers.
Honestly, bonkers. Yeah. And the more we know now, the more I'm just like baffled.
Oh yeah.
I mean, ignorance is bliss in the past, right? But now that we know there's like the prevalence of this and like how the impact of if you don't get this treated, the long-term impact.
Yeah. Even the like physical impacts for children. Like I was not even aware of that.
For sure.
Yeah.
Yeah.
But the more you know, the better you can do, or whatever the phrase is, how you
I don't know that one.
I don't know. It's like I feel like Oprah said it maybe.
I'm sure she did. But yeah, there's got to be something going on out there. And I mean, of course, there is with the Regina Perinatal Network, Health Network. But there's got to be more out there to educate, prevent, necessarily, I don't know how you really prevent this, but more so educate, consistently screen, do these things, systematize this so that more people can get the support they need.
Yeah. I mean, I think there is like a way to prevent, which is what you said with that screening. But there's some stuff going on, but not nearly as much as there should be. So according once again to the Canadian Perinatal Mental Health Collaborative, most often money from perinatal mental health gets grouped with a general mental health funds, which creates a problem because clear and unique plans are needed to make sure perinatal mental health programs get enough money consistently. In Canada, each province and territory runs most of the healthcare services following national rules set out by the Canada's Health Act. They get money from the federal government, but they usually decide how to use it. So provinces make their own decisions based on what their perceived needs are. But sadly, few places even think about perinatal mental health. And that's why it's crucial for each province and territory to get targeted funds for perinatal mental health programs. Due to the fact that there's no national strategy for screening and treating of PMADs, some healthcare professionals may not be screening for it at all, while others may be using clinical judgment only, and then others may still be using validated screening tools. It is also unclear in our research what specific perinatal mental health training professionals have received and what treatments are actually readily available.
I think that's a big thing to dig into is like, what's the training for the healthcare providers?
Yeah.
Is there enough training on this? Because I feel like if they were trained, why wouldn't they be screening? Like it's a very legitimate cause for concern.
Yeah.
So,
and like,
let's look at the curriculum in the universities that they're getting in the med schools. Like what's going on there?
Yeah. It should just be like part of the checklist of like doing screening for this. Like it shouldn't. Yeah.
And but like just the awareness of these disorders and the fact that this is, and
so
I think that goes back to our like gaslighting episode because women aren't studied, and so this mental health is a thing, but the specific impacts on mental health for women, especially perinatal women who have just had babies, those women even more are unstudied because they just had a baby or are pregnant. So lack of information and support for these people.
And I feel like, healthcare professionals don't even want to touch like a pregnant woman with like a 10-foot pole. They're always like, don't do anything when you're pregnant.
Can't take anything. You can't do anything. This might cause something, but we don't know. So just don't take anything.
So then I feel just like everything is like, oh, we don't want to do it. 'Cause, I mean, obviously
hands off.
Yeah.
It's not me, not my problem.
No. Yeah.
They're like, can't test it. So we just don't know.
Yeah.
That's so unfortunate.
It is really unfortunate.
Ugh, Canada, get your act together. Alrighty. Because there are some countries actually out there like Australia, Ireland, and Scotland that are making decent strides in this area. They're setting aside special money for perinatal care. Where in Australia, the Centre for Perinatal Excellence, we have a center, has put over 36 million into creating digital tools for perinatal mental health. One of these tools, called iCope, is an app that helps with screening and diagnosing mental health issues. It's easy to use, can be used on tablets and healthcare settings, and collects data that helps with planning, care, and tracking progress over time. Not a hard thing. We have all kinds of mental health. Not mental health. We have like what's our health? eHealth, like that could be integrated in where you track it, take some tests, and then track on to see if you're like there's It's not
just
rocket
get sent
science.
to your like healthcare provider if it like peaks and something.
Yeah, totally. You have to take like push notifications. You have to take this test every week and see where you're going, and then you have calls based on that virtually on your phone. I should just develop this app. Let's not say anything more.
I'm like, watch out. In a couple of years, it's coming.
Yes, but honestly, like clearly we have something to learn, and we need to be watching and learning what these other places are doing. And get this done fast. Like, I'm not waiting another million years before something else happens. Like, we just got some of this information now in 2020, 2021. Like, let's get moving.
Brick, yeah. So, if you live in Saskatchewan and you feel like you or someone you might love may be experiencing perinatal mental health issues, there are a few avenues that you can consider for support. I'll go over a couple and then Skylar will dig into a few more. But you can access private clinical therapy. There are a handful of counselors in Regina with education and or have lived experiences with PMADs. Obviously, there is the financial constraint because you do have to pay out of pocket and then your insurance might cover it, may not. Next is that we also encourage you to speak with a public health nurse, either at your baby's vaccine appointments or by calling 811, or even when they come visit you at home after those first few days at home. They are able to conduct the Edinburgh postnatal depression screening, and from there, they will then refer you to the maternal wellness program. The maternal wellness program consists of a public health nurse making regular phone contact with you over a set period of time to check in and to talk about how you're feeling. And then also, as Lynn mentioned, there is a new center in Regina that's opening on June 1st, entirely focused on maternal wellness. And it's called the I Love You More Wellness Center.
Can't wait for that.
Yes. And then lastly, you can always chat with your general practitioner or gynecologist or OB about how you're feeling. Ask for a referral for public mental health services or discuss medication options for your treatment.
Great suggestions. And honestly, Lynn, she covered a lot of, in the last couple of questions we asked, a lot of the practical things that we as individuals can do to support changing the stigma, supporting others, supporting other moms. So I'm not going to go through all of those things again, but I do want to mention how you can take advantage of the Regina Perinatal Health Network, where Lynn works. So if you live here in Regina or if you live in Saskatchewan, this is something to think about. So reminder, the program the Regina Perinatal Health Network offers is free. You don't need a referral. So you don't have to wait around from your family doctor and whoever to get referred. You can just go right online, and it's open for anyone experiencing these symptoms. You don't need any forms filled out or tests showing that you have them. All you need is yourself.
Yeah.
All you do is go online at their website. You can just search Regina Early Learning Center, and you can find all the information on their website about the Perinatal Health Network, and you can book in with one of their weekly group sessions that are free, or book a one-on-one individual free session as well.
Yeah, we'll include those links in
so it's all free, it's all easy, low barrier, and I mean, you get to work with Lynn, which you've met, is amazing. I will also reiterate what Lynn mentioned in terms of other supports across the province. So in Saskatoon, they have Mother May I, and in Swift Current, they have other early years family centers that support perinatal health. And lastly, and very importantly, I will say, we as individuals, we as moms, we as the village just need to have the patience and the grace for those who are experiencing, who we think, or maybe we don't know, or they are experiencing perinatal mood and anxiety disorders. Stay humble if this is you, by knowing your limits as a professional and referring clients to practitioners and organizations educated in maternal mental health. This ensures parents are receiving the best possible care for their specific needs. And that's it, folks. That's all from us today. We really hoped you learned something, because we learned a ton.
God, so much.
And yeah, thank you for tuning into another episode of The Scaries.
Thank you, as always, for joining us as we confronted these very terrifying but real-life statistics impacting women and childbirthing people. Stay tuned for more ways to make a positive impact. Together, we can make the world a little less scary for women and girls.
And make sure to follow us on Instagram at RaiseHerCo and scaries.podcast, and on TikTok at RaiseHerCo. And remember, change starts with awareness, which we're doing, and now it's time for the action. So take that action. Thank you for being part of the Scaries community and making the world a little less scary to exist as a woman. Bye.